Getting health insurance to cover medical transition can feel daunting, but you don't have to figure it out alone. This video will give you the tools to understand your insurance plan, how to appeal insurance denials for transition-related care, and information on where to reach out for help. We will focus on troubleshooting using health insurance you already have, not finding health insurance. If you need help getting health insurance, you can start by reaching out to a MNsure Navigator. The Minnesota AIDS Project, Planned Parenthood, Family Tree Clinic, and many other places have MNsure Navigators available who can help you enroll.
Before we get into a more in-depth discussion of health insurance, let's go over a few key healthcare rights. In November 2016, a Ramsey County District Court judge struck down the statute denying transgender people on medical assistance and Minnesota Care access to medically necessary services related to gender transition, saying that it was unconstitutional. This ruling ended the blanket exclusion of coverage of transition-related surgeries for people covered by these programs. It's important to note that this ruling will stand, regardless of the status of the Affordable Care Act. While the future of the Affordable Care Act into 2017 and beyond is uncertain, it's the law right now. And under the ACA, it's illegal for health plans subject to the Act to do the following things. 1. Exclude transition-related care from coverage. For example, an insurance company can't say that all care related to gender transition is excluded. Insurance companies also can't place limits on the conditions of coverage for transition-related care if the limits are discriminatory. For example, excluding a specific service for transition if that service is covered for people with other conditions is prohibited. 2. Refuse to enroll transgender people in a plan, cancel coverage, or charge higher rates because of their transgender status. 3. Deny coverage for care typically associated with one gender. Insurance companies can't deny you coverage for care you may need, but which the company assumes you don't need based on their records or on your assigned sex at birth. For example, an insurance company can't deny a trans woman coverage for a prostate exam because she's listed as female in their records, and they can't deny coverage for her gynecological care because her sex assigned at birth was male. Unfortunately, these regulations don't mean that all insurance companies must cover transition-related care. Some plans simply are not subject to the Affordable Care Act. It will also take time for these rules to be enforced consistently, which is why it's important for trans people to use their plan's appeal process if their claims are being denied. And, as noted, the future of the rules themselves is uncertain at this time. However, even if the ACA is completely repealed, the impacts on Minnesota may be limited because of the Minnesota Care Medical Assistance Court decision, the guidance that plans regulated by the Minnesota Departments of Commerce and Health cannot exclude transition-related coverage, and the fact that the Minnesota Human Rights Act still bars discrimination based on gender identity in medical settings. As a general note, anytime you talk to anyone from your insurance provider, take notes. Write down what was said and who said it. Don't be afraid to ask for people's names. Ask for documentation in writing.
The first step to using your health insurance to cover your medical transition is to gather information. To start, check out your full insurance policy. It might be called your Certificate of Coverage, Summary Plan Description, or Contract. This document lays out all the services your plan will and will not cover and outlines what actions you need to take to receive your health benefits. You should get a full copy of this document around the same time you get your insurance card. If you don't have your full plan description, contact your insurance company and request a written copy of your Certificate of Coverage. Depending on your insurance company, you might be able to get it online through your plan's user portal. When you have your full plan in front of you, you'll want to flip through and see if your plan states that it covers gender reassignment surgery, hormone therapy, mental health counseling, and other medical visits. Most plans aren't yet written to affirmatively say they cover transition-related care, so you may have to check the exclusions section. Many plans will say that they exclude gender reassignment surgeries and other related procedures unless medically necessary. So, while this might seem intimidating, if your plan says it excludes gender reassignment procedures unless medically necessary, you should be able to use your health insurance to access care. If your plan documents do say the plan excludes gender reassignment procedures, sometimes they say sex reassignment instead, without the unless medically necessary statement at the end, please reach out and contact OutFront Minnesota, Gender Justice, the Transgender Law Center, or another LGBTQ-friendly legal organization or lawyer for assistance. They will examine your insurance policy and ask questions to determine the best way to proceed in seeking the removal of the restriction. Possible avenues for seeking change include advocating with an employer to change their plan, filing a complaint with the Minnesota Department of Human Rights, the Minnesota Department of Commerce, or the Minnesota Department of Health. Due to anticipated shifts in federal policy, current options for filing complaints with the U.S. Equal Employment Opportunity Commission or the U.S. Department of Health and Human Services Office for Civil Rights may change in 2017 or beyond. To familiarize yourself with the claim process or to file a civil rights claim for yourself, you can visit this website. For more information on Section 1557 of the Affordable Care Act, this National Center for Trans Equality fact sheet is a great start. If your plan indicates that procedures are covered if medically necessary, your insurer is saying they'll cover procedures if they satisfy certain coverage criteria. The coverage criteria, sometimes called the care criteria, are the standards the insurance company uses internally to determine whether or not the care you want covered is medically necessary. You may want to contact your insurance plan again and ask for a copy of the coverage criteria for gender reassignment. If it feels intimidating, write down what you want to say beforehand and practice, and have a friend sit with you for support. These criteria should either be the same as the most recent version of the World Professional Association of Transgender Health, WPATH's, standards of care, or less restrictive. You can find the most recent version of the WPATH standards of care online here. If your insurance plan doesn't adhere to the most current standards of the WPATH standards of care, currently version 7, reach out and contact OutFront Minnesota or the Transgender Law Center for assistance in working on getting the plan to update their criteria, especially if you believe the version the insurer is using may result in a denial, but the current version would not. At this point, you'll know what transition-related care your insurance plan says it will cover and what you need to do to meet their criteria to get that care covered. You should be able to work with your physician and or other care providers to meet your insurance plan's criteria and get your transition-related care covered.
So what happens if you receive a denial of coverage for transition-related care that your plan should cover? First, find out what led to the denial of coverage and learn your insurance plan's procedure for appeals. They have to provide this information, and it's usually included with your denial notice. If you call to get the information, make sure to take notes and get the names of who you talk with. Keep in mind that it's worth checking to see if your doctor or someone at your clinic can help you file your appeal letter, especially for denials of care for procedures like prostate exams, pap smears, breast or chest exams, or for routine physicals or hormone level blood draws. An initial appeal may be readily resolved by pointing out that you've met the insurance plan's criteria. You'll need the denial letter, and if you don't already have it, a copy of your plan's full benefits language and the detailed guidelines that explain what the company considers medically necessary. Your appeal will likely require that you prove your treatment qualifies for coverage under your plan's benefits and rules. So you will want to focus on the plan's language and show how the procedure you are seeking fits into a category of care that the insurer has promised to pay for. While each insurance plan's appeal process may vary, you typically submit an appeal letter, a letter from your doctor addressing specifics of your case, any pertinent information from your medical records, and any other supporting information that demonstrates why the medical care should be covered. When you write your appeal letter, be sure to include the following components. 1. Your identification, your name, policy number, group number, claim number, and any other information the insurance uses to identify claims. 2. Whatever reason for the denial that was highlighted in the denial letter itself. 3. A brief explanation of why the medical care you are seeking is appropriate and medically necessary. Typically, this will be outlined in a letter of support from your doctor or care provider, but it can also be helpful to include a brief synopsis in your letter. Whenever possible, point to specific language in the coverage criteria and/or the WPATH standards of care that support your statement. And 4, a direct ask that the insurer reconsider the denial and approve coverage for the procedure in a timely manner. You can check out this sample appeal letter for an idea of what you should include in your specific appeal. Even if your initial appeal to your company is rejected, you still have more options. If you get your insurance through your job and your employer has a self-funded health plan, which means that the plan might be administered by an insurance company but is paid for and backed by the employer itself, your next step is often to consider filing a discrimination complaint against your employer with the federal government. Of course, many people are hesitant to file a complaint against their own employer. However, if your plan is fully funded, either through your employer or an individual policy, you can use your state's appeal process. The form to request an external review if you were enrolled in an insurance company or a Blue Cross Blue Shield plan is here. If you are enrolled in an HMO, the form is here. These appeals go through the Minnesota Departments of Commerce or Health, respectively. There is a $25 fee for each review, but that is refunded if the review decides in your favor. You can request a hardship waiver if you need to. Reviews may take up to 45 days, but you can get an expedited decision in 3 days in urgent cases.
Looking for more information on navigating insurance as a trans person? OutFront Minnesota has some great Minnesota-specific resources available here. You can read more general information about appealing insurance denials at Health Law Advocate's website here.